So what we're going to talk about now is actually called vertebral subluxation. That's the diagnosis anybody comes into a chiropractor for. That's what chiropractors diagnose, we correct, are what's called subluxations, or vertebral subluxations. Sub means less than. Lux means dislocation. Ation means a condition. So a condition describing less than a dislocation is actually what the term means. Very simply, what does it look like? I'm a visual person. I have to see. Normal spine should be straight up and down. Pelvis should be level. Shoulders should be level. Ears should be level. This is a subluxation. And I do see patients like that quite a bit. Or pelvis tipped one way or even forward. Rotated forward or backwards. Up or in or out. Rotation of the vertebrae, lateral flexion of the vertebrae. So when a vertebrae gets out of alignment and doesn't return, that's a subluxation. We have a joint problem now that's going to cause joint damage and destruction, and also it's going to cause neurological interference. These are nerve roots, which I'll show in a diagram. But a vertebrae, even from the side, the spine, a healthy spine from the side, there should be a forward curve in the neck. A baby in utero, and actually the studies indicate even in the utero we're starting to have secondary curvatures. Here's the primary curvature embryologically. Secondary curvature, as the baby starts to pick its head up, forms a forward curve in the neck. So it's a reversal from that primary C curve. Now it becomes what's called a lordosis. We all maintain a little bit of the kyphosis, the round shouldered. As we start to move or stand or walk, it forms a forward curve, actually in the lumbar spine, or studies show embryologically in utero. And the tailbone curves backwards. So from the side, our spine should look like this. But unfortunately, over the years, we start to do this, or we start to do this. Those are subluxations as well. So you have X, Y, and Z axis. Vertebrae can turn, pivot, twist, go forward, backwards, or combinations thereof. Those would be subluxations. So, subluxation is broken down into two main components. Let's use a different color here. One is biomechanical. That's the vertebrae out of position. The other one, the more important one, is really the neurological. Now we're starting to get into the wiring, okay, or the nervous system. Biomechanical is made up of, or broken down into 4 different segments, or sections, which I'll write down and then we'll diagram. Biomechanically, when any joint goes out of position, whether it be the spine, a shoulder, a knee, a hip, it's going to cause soft tissue damage. Okay? Because of the soft tissue, that joint's going to become restricted or tight. Okay? There's different names for all this stuff too, but the concepts is what I'm really trying to get after. Because of this, you'll have edema or swelling, which is your body's attempt to try to heal this. Eventually, even the joint wears out, and they call that arthritis. So when a vertebrae gets out of position, usually it's because of 4 different factors. It's usually trauma, okay, a fall, a slip, and you may not feel it right away. You may get up and put a Band-Aid on your knee or something because that's what's bleeding, but you don't realize what your spine, the trauma that it just went through. It tore some ligaments or it tore some soft tissue in the fall. And all these little traumas added up can become a problem. So one of the first things we have is trauma. Second thing would be posture. Now everybody, including myself, we don't have the perfect posture. Okay? I used to be very good, but lately not so much. But our shoulder might be a little higher on one side. We sleep on one side, always on the same side every night. 20, 30 years later, what is it going to do? It's going to cause some structural change. Then we sit on a wallet in our back pocket, or if we have a purse on our shoulder for women, or kids on their hips. All these little postural things. We sit in the computer and our head goes forward, and over the years, that's why our neck gets